Okay, so this video is meant to serve as a rapid review for the major cranial nerve pathways that we covered in class. So we're going to go facial nerve, trigeminal, and then oculomotor, trochlear, abducens, and then end with glossopharyngeal and vagus.
So collect your thoughts. We're going to start with the facial nerve. Get that mental picture. Get that boomerang shape right there of the facial canal. Here we go. So first, the facial nerve goes into the internal acoustic meatus. It travels until the bend, and right before that bend, it hits the geniculate ganglion. That is a sensory ganglion that's just holding the cell bodies of those sensory components. So before it continues down in the facial canal, it's going to give off its first branch. And that branch is going to go through the facial canal hiatus and come out, and it's going to be called the greater petrosal nerve. It's going to go across the foramen lacerum, not through, just across. And at that point, it's going to be joined by the deep petrosal nerve, which is coming off of a plexus around the internal carotid artery. So that deep petrosal nerve is going to be postganglionic sympathetic fibers. And the greater petrosal nerve is going to be preganglionic parasympathetic, GVA, and taste. So those nerves are going to join together and be called the nerve of the pterygoid. They're going to go through the pterygoid canal, come out into the pterygopalatine fossa, and they're going to hit, that nerve is going to hit the pterygopalatine ganglion. Okay. And so the preganglionic parasympathetic is going to synapse here, leave as the postganglionic parasympathetic, and the sympathetic fibers are just going to travel through because they've already synapsed, and they're going to travel out to the greater palatine, lesser palatine, nasopalatine, and lacrimal. Okay, so that's the first branch of that facial nerve. Then it's going to go down that facial canal where that bend was. It's going to give off a tiny motor branch to the stapedius. And then it's going to give off a bigger branch in the same direction called the chorda tympani. It's going to cross the handle of the malleus, go down past the tympanic membrane, whatever. And then it's going to go off and split. So the chorda tympani is made of a couple components, taste and preganglionic parasympathetic. So the taste is going to branch off and meet up with the lingual nerve, and that taste component of the chorda tympani is going to go and service the anterior 2/3 of the tongue, while the lingual nerve that it joined is going to be doing the general sensation to the anterior 2/3 of the tongue. And you're going to see that in trigem. The lingual nerve, as you remember, is a branch of V3, which is mandibular. Okay, so that's the taste component of the chorda tympani. The preganglionic parasympathetic, as well as some sensory, I believe, is going to, it's just preganglionic parasympathetic, is going to go and synapse in the submandibular ganglion. Now, if we'll recall, that submandibular ganglion is actually attached to the lingual nerve, the V3, the mandibular part of the trigem, and that's why it's all close together, but functionally it's used by the facial nerve. And after it synapses in the submandibular, it's going to go and service the sublingual and submandibular glands. So, going back to that main facial nerve, it's going to exit the stylomastoid foramen, give off a posterior auricular branch, which is going to have a small GSA component for a couple different things, and then mainly a branchiomotor component that supplies the occipitalis, vestigial auricular muscles, etc. Now, the facial nerve is going to continue past that posterior auricular branch. It's going to send off a small motor nerve as well to the stylohyoid and posterior digastric. And then it's going to continue up into the parotid gland, and it is going to plexiform and go out as those 5 terminal brachiomotor branches. Them zebras be mad crazy. Temporal, zygomatic, buccal, marginal mandibular, and cervical. And that is the entire facial nerve. Now we're going to go and skip on ahead to the trigeminal nerve. Facial nerve was 7, trigem is 5. This one's a little bit bigger because it has 3 parts, V1, V2, V3. We're going to start with V1, which is the ophthalmic. So the first thing, it's going to come off the trigeminal ganglion, just like all 3 parts. And the ophthalmic, the first branch it's going to give off is the recurrent meningeal nerve. That goes to the tentorium cerebelli and other dura. And mind you, V1 ophthalmic is all sensory. So don't even worry about it. It's just all sensory. Once it gives off that teeny little recurrent meningeal nerve, it's going to go, and just before it goes into where does the ophthalmic nerve go? The superior orbital fissure. It's going to branch into 3 parts. From medial to lateral, it's NFL, nasociliary, frontal, and lacrimal. So then it goes to the superior orbital fissure, and starting with the nasociliary, that most medial, it's kind of thin, kind of skinny, but it gives off 4 things. The mnemonic to remember that is pale, posterior ethmoid, anterior ethmoid, inferior trochlear, and long ciliary. There's multiple of the long ciliary. The little hairs go into the eyeball. And also a note is the anterior ethmoid, its terminal branch is the external nasal. Then moving on to that frontal, that is that main nerve that you saw in the eyeball dissection. It was pretty thick, and it just branches into 2. Medially, it's going to be the supratrochlear, and then laterally, it's going to be supraorbital. And those are what you saw on the external of the skull. Now, the last branch is lacrimal, most lateral, and it just goes to the lacrimal gland. Easy peas. Now we go to V2, maxillary. Also completely sensory. So similarly to V1, it's going to give off 1 branch before it does the crazy stuff. And this time, instead of the recurrent meningeal for ophthalmic, it's going to be the medial meningeal nerve for maxillary. It also goes to the dura. So the foramen that the maxillary nerve goes through, V2, is the foramen rotundum. And when it goes through that, it's going to enter the pterygopalatine fossa. That should sound familiar because that is the same place that the facial nerve goes. The same place that the great petrosal nerve goes. Anywho, what do I know? First thing that happens when it goes through the foramen rotundum is a few branches are going to come off and go to, the mnemonic is not going to lie, please pass me in parentheses. So these nerves are going to come off and go to the nasopalatine, greater palatine, lesser palatine, posterior, superior, lateral, nasal, pumpkin spice, latte, nasal, and the pharyngeal. So the nasopalatine, greater, and lesser palatine, the NGL sounds familiar because it's the same thing that the greater petrosal nerve goes to. And that is because attached to all these branches is the pterygopalatine ganglion, which is not used by V2 maxillary that it's attached to. But it's right next to the facial nerve, and cranial nerve 7 does use the pterygopalatine ganglion, though it is structurally attached to V2. So that is the first branch coming right after, or the first branch of multiple things coming right after you go through the foramen rotundum and you're in the pterygopalatine fossa. Next thing you hit is a fissure. You have the superior orbital fissure for V1, so it only makes sense that the inferior orbital fissure is for V2, maxillary. So right after you come out of that inferior orbital fissure, you give off a simple nerve called the zygomatic nerve. And then you make up for that simplicity by creating the superior dental plexus, which makes sense, we're in the maxilla. But the things that contribute to that plexus are 3 nerve branches, all superior alveolar, which again makes sense, we're in the maxilla. It's going to be the anterior, middle, and posterior superior alveolar nerves. Those are all branching off to make the superior dental plexus in the pterygopalatine fossa. And that is pretty much the bulk of it. Then you have that one little bit that's left of the maxillary nerve going through the inferior orbital foramen to become the infraorbital nerve. And that is the end of V2. Now we have V3. V3 has does not have a place in my heart. I hate it. So it's going to leave the trigeminal ganglion, and this is sensory and motor. Before it does anything, it's going to go ahead and go into that foramen that it goes into. V3 mandibular goes into the foramen ovale. Now we're in the infratemporal fossa. Okay. It's going to give off two things before it branches into anterior and posterior division. First, it's going to give off the spinous nerve, which goes back and up through the foramen spinosum, accompanied by the middle meningeal artery. So that spinous nerve goes right back up. And then the next thing that comes off is this stupid branch that I can never remember the name to. It's an Anki card. It asks about the mastication and the tensor veli palatini and the tensor tympani, and it innervates the muscle the same name, medial pterygoid nerve. I don't know. Just remember medial pterygoid. Then we have, like I said, we're still in that infratemporal fossa, and we're going to break up into the anterior and posterior division. We'll start with the anterior. So the anterior division has two main parts. It's supposed to be mainly motor, and it is, except for one of those main two parts is the buccal branch, which is sensory. So the buccal branch comes off the anterior division, and also this little pitchfork-looking branch that goes to a bunch of muscles, and that is why it is mainly motor. It goes to the masseter, temporalis, and lateral pterygoid. So I guess that ties in why the medial pterygoid nerve is that first little or second little branch before the divisions. So the anterior division is what gets that lateral pterygoid nerve. And these are all in that V3 area of the face that you remember that diagram, so it makes sense. So anterior division, masseter, temporalis, lateral pterygoid, all that motor innervation, and then buccal sensory. Now posterior division. First thing that happens off the posterior division is these two little branches that go around the middle meningeal artery and meet back up. And that is called the auriculotemporal nerve. And that innervates the parotid gland, the temporomandibular joint, the external acoustic meatus, external surface of the tympanic membrane, superior temporal region, all the things you think of when you think of auriculotemporal, that area of the ear and side of the head. So, again, anastomosis is whatever around the middle meningeal artery. That's the first thing in the posterior. Then we're going to move on, and we're going to go and give off a lingual branch. You remember that because we just talked about it with the facial nerve. The chorda tympani meets up there. Why? Because the chorda tympani wants to synapse in the submandibular ganglion, which is attached to the lingual branch. So here comes that lingual coming off. There's the submandibular ganglion, and the lingual, like we said before, and the facial is going to do the general sensation of the anterior 2/3 of the tongue. So, posterior division. First, you got the auriculotemporal going around the middle meningeal. Then you have the lingual with that submandibular gland on it, ganglion on it. And then we are going to have one more little branch before the thing ends. And it's going to be similar to the facial nerve, having that branch at the bottom before those terminal branches. This one's going to go to the mylohyoid and the anterior digastric. Whereas facial was stylohyoid and posterior, this one is mylohyoid and anterior digastric. So posterior division has those three branches before it goes through the mandibular foramen. At that point, it becomes the inferior alveolar nerve, which kind of makes sense because you had the superior alveolar nerve in V2 for the maxillary. So it's ending with the inferior alveolar nerve traveling, and then it came through that mandibular foramen,
and it's going to exit onto the face through the mental foramen, and then it's going to be named the mental nerve. So there you go. That was V3. You had 2 branches come off, spinous and medial pterygoid. Then it broke into A and P divisions. A had the motor to the masseter, temporalis, and lateral pterygoid, as well as the buccal sensory. And then posterior had the 3 branches coming off, auriculotemporal around middle meningeal, lingual with that submandibular ganglion, mylohyoid, and anterior digastric little extra thingy. Then we go through the mandibular foramen, become the inferior alveolar, go through the mental foramen, and there you have the mental nerve. So that's trigem. Now we're gonna just push on through. We're gonna have a little break with how hard it is. With cranial nerves 3, 4, and 5. Oculomotor, trochlear, abducens. Let's start with oculomotor. So oculomotor is going to be GSE and GVE. So it's going to be somatic motor as well as visceral motor. Oculomotor, it makes sense. So as we recall from lab, the oculomotor, it's going to be one of those that goes on the lateral part of the cavernous sinus, blah, 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 blah. And then it goes through the superior orbital fissure. And as you learned in lab, like the day of, you didn't know this beforehand, it divides into divisions. So the superior division's the easier one because it just goes to 2 muscles, and it's just somatic motor. It goes to the levator palpebrae superioris and the superior rectus. That's the whole superior division. Then you have the inferior division, and that's where both of those parts come in, the GSE and the GVE. So you have the GSE, and that's going to go to the muscles of the medial rectus, inferior rectus, and inferior oblique. So basically the rest of those muscles, with the exception of 2 that we're going to cover later on. So what's missing from that? Seems like the superior oblique and the lateral rectus are missing. Moving on. So inferior division goes to medial rectus, and inferior oblique. Then you have some visceral motor components left, and there's a ganglion that you saw in the lab coming, it's near, one of the trigem things near that. Anyways, you have the short root of the ciliary ganglion coming off of the inferior division, and shocker, it's going to the ciliary ganglion, and those fibers are going to synapse and leave as the post-ganglionic parasympathetic motor via short ciliary nerves. So the short root of the ciliary ganglion is going to the ganglion, and the short ciliary nerves are leaving the ciliary ganglion. And it's going to innervate the ciliary muscles and the pupillary sphincter. So oculomotor is doing ciliary muscles and pupillary sphincter as well. And then that is basically the entirety of the oculomotor. So really not that difficult. Just remember you have superior and inferior divisions. And I want to say that the ciliary ganglion is attached to the nasociliary part of V1. Could be wrong, but that's what I'm going to teach myself. Let's move on. Cranial nerve 4, trochlear. We have a mnemonic in that lab we learned, SO4, LR6. SO4, that's because superior oblique is going to be innervated by a trochlear nerve. And that is the whole path of it. So we have it coming, and it goes through, went through the cavernous sinus, it goes through the superior orbital fissure, just like the other, and it goes straight to motor innervate superior oblique. Boom, bada bing, done. Deucens. So CN6, LR6, like I said, goes to the lateral rectus. It's also going to go through the cavernous sinus, very close to the internal carotid, a little extra piece of info. It's going to go through the superior orbital fissure, just like the rest. And it's going to go to the lateral rectus, and that's it. Now, to make up for how easy those 3 were, well, 2. we're going to go to the glossopharyngeal and the vagus. So we're going to skip ahead, go to 9 and 10. So let's start with 9, glossopharyngeal. It's got like every component ever, and it's fine. Before it goes through the foramen that is associated with it, which is a jugular foramen, we've got a superior ganglion that's above that jugular foramen, and the inferior ganglion that's below the jugular foramen. Superior and inferior ganglion are both sensory. The sensory somatic is going to be in the superior, and the sensory taste and visceral sensory are going to be in the inferior ganglion. So the whole nerve goes through. First thing that happens is we have a branch off. It goes off and to the right in your drawing. It's the tympanic nerve. Tympanic nerve goes through the tympanic canaliculus, a little canal, and it comes out, and that tympanic nerve has both GVE and GVA fibers, so both visceral, motor, and sensory. The visceral sensory is going to plexiform out right after that canaliculus and become the tympanic plexus. So then all that's left to continue is the visceral motor. It's going to travel, and it's going to change names now that it's just that GVE. So once it's out and the tympanic plexus is left behind, it's going to become the lesser petrosal nerve. So recall, you at one point had that greater petrosal nerve, and now you have the lesser petrosal nerve. A good way to remember this is kind of that you remember the greater petrosal nerve is that part of the facial nerve that went through the facial canal hiatus. Before it did anything else, it just went through that little place. This is very similar, except for instead of the facial canal hiatus, it's the tympanic canaliculus. Same concept, though. It's like one of the first things that takes a turn and goes out as a branch. So anyways, we have that lesser petrosal nerve now, and it's going to go through a foramen. It's going to go through the foramen ovale. What else goes through the foramen ovale? That's right, V3. Anyways, and it's going to reach the otic ganglion, which, funny I said that, is attached to V3, I think. And so those preganglionic parasympathetic are going to synapse in that otic ganglion, and it's going to leave as postganglionic parasympathetic to innervate the parotid gland. Plot twist. It's like, forgot about that gland, and then boom, there it is. So that is the first thing that comes off right below that inferior ganglion, right after the nerve comes out of the jugular foramen. Then you're going to have another branch that's going backwards, very similar to a bunch of the other cranial nerves. It's going to be the auricular nerve, and that's just somatic sensory, and it's going to have all these auricular branches. And then you're going to have a branch come off, just a motor branch, and that motor branch is going to come off and be the stylopharyngeus, because it innervates the stylopharyngeus, glossopharyngeal, stylopharyngeus. And then you're going to have the carotid sinus nerve come off, which is completely visceral sensory, and guess where it's going to go? Yeah, the carotid bifurcation, to do the body and the sinus, because glossopharyngeal, number 9, doesn't play games, and it does both with the carotid sinus nerve. All that's left of cranial nerve 9 now, that after the jugular foramen, you have the tympanic nerve come off, the auricular, the stylopharyngeus, and the carotid sinus, so I would call that 4 branches. Then you continue with cranial nerve 9, down a little bit, and then all that's left, we have general sensory, the visceral sensory, as well as taste. So the taste and some general sensation are going to go to the tongue, but this time it's going to be the posterior 1/3 to pick up the slack of what the facial left behind, as well as the lingual from trigem. And then some that's left is going to plexiform as the pharyngeal plexus, and that's just general sensation to the pharyngeal mucosa. So that's how the glossopharyngeal ends. It's got those 4 branches. It's going to continue down as cranial nerve 9, and it's going to bust off a little move to the posterior 1/3 of the tongue for ginseng and taste, and pharyngeal plexus its way into oblivion. Move on to Vegas. Viva Las Vegas is the last one of this stupid thing. You may be on an elliptical, you may be in the car. It's almost done. Same thing as before, very similar to glossopharyngeal. Don't get it twisted. Whereas glossopharyngeal was kind of like spaghetti looking with all those branches. This one's more of a straight line with some branches coming off. So think of it very vertically. Same as before, same as with glossopharyngeal, you have superior ganglion and inferior ganglion. And it's also right above and below the jugular foramen because they both go through it. Same thing, both sensory, and same way somatic on top, and then taste and GVA on bottom. So that whole nerve goes through there, and the first thing that happens is 2 GSA branches come off right after another. The first one goes up and back through the jugular foramen, and it's called the recurrent meningeal branch. You've heard that name before because it's named a bunch of things. That's like the name of a bunch of things. But that's going to go right back up and through the jugular. And that is general sensory, somatic sensory. And then what is going to come off right after that is, shocker, an auricular branch. So an auricular branch came off actually in the glossopharyngeal as well. And it was also just somatic sensory. So we have an auricular branch from the vagus as well. Those actually come up after the jugular, but before the inferior ganglion. So it's like right off the bat. Then you have that inferior ganglion, and then that cranial nerve 10 is going to continue down. It's going to have 4 main branches as well before its end. So bear that in mind. First thing that's going to happen is the pharyngeal branches. And those are just going to go to a few different places, pharyngeal derived. And the components of that are going to be GVA, which is visceral sensory, branchiomotor, and taste. So if my memory serves me correctly, the taste is going to be the epiglottis, but don't quote me on that. So that's the first thing, is the pharyngeal branches. Then you have the second grouping of branches, which is the superior laryngeal nerve. So you had pharynx, now you got larynx, superior laryngeal nerve. That's going to have a little bifurcation. It's going to branch into 2 parts: internal laryngeal branch and external laryngeal branch. The internal laryngeal branch is going to be that GVA part, and it's going to provide sensation to the laryngeal mucosa superior to vocal folds, which makes sense because this whole thing is coming off of the superior laryngeal nerve. So that internal branch is the sensation. And then that external branch is very simple and small. It is literally just called the external branch to the cricothyroid. Cricothyroid. All right. Now, I mentioned the first 2, the pharyngeal branches and the superior laryngeal nerve. There is one that comes off of one of those 2, or in between it. It's very variable, and it is the carotid sinus nerve. Similar to glossopharyngeal, also has a carotid sinus nerve, but vagus is cheap. So the carotid sinus nerve actually just innervates the carotid body, not even the sinus. Why is it named that? I don't know. And that's GVA. So then you've counted to 3. You've got one more thing coming off before its ending bifurcation, and it is called the recurrent laryngeal nerve. Lucky for us, it does continue and change names to make more sense. It becomes the inferior laryngeal nerve, since it's underneath the superior laryngeal nerve. But what do I know? And that recurrent laryngeal / inferior laryngeal nerve is going to go to laryngeal, pharyngeal, and esophageal muscles. So it's going to muscularly innervate all of those larynx and pharynx and esophagus muscles, and go to the mucous membrane. In fact, it's going to provide sensory innervation to the laryngeal mucosa inferior to the vocal folds. And I just now realized that the reason your voice gets hoarse and stuff when you have a nerve lesion to the recurrent laryngeal nerve is because that's really the only nerve that provides a bunch of the motor innervation to all of that throat area. I was thinking superior laryngeal did the same thing, but it just goes to the cricothyroid for motor. Boom, there you go. So we've gone down, as cranial nerve 10, we've given out the four main things: pharyngeal, superior laryngeal, carotid sinus nerve, somewhere in between there, and then recurrent laryngeal. And then it's going to end with just GVE and GVA fibers. We're turning all visceral. And it's going to go to both thoracic viscera and abdominal viscera. And those motor fibers are going to synapse in cardiac and pulmonary ganglion, as well as enteric ganglion, respectively. And that's how the vagus nerve ends. Quick little recap: we have the superior and inferior ganglion, just like it had on the glossopharyngeal. We have two branches come off before it hits the inferior ganglion: the recurrent meningeo branch going back up through the jugular foramen, the auricular branch, and then that inferior ganglion. Then we have those four branches: pharyngeal, superior laryngeal, carotid sinus, recurrent laryngeal, and then we're going to end with thoracic and abdominal viscera. That's it.